for joining us as we cover some of the topics that we've covered in 2025 in the first quarter. In the first 3 months, we have went over a number of different topics, and we have explored different areas of mental health research. And I'd like to thank everyone who has subscribed to the channel, and also to those viewers that watch the videos. Please feel free to provide suggestions for the topics that you would like to see covered. We went over a number of different therapeutic approaches for psychotherapy. We went over dialectical behavioral therapy, as well as cognitive behavioral therapy, and a number of experimental therapies that have been reviewed and put into practice more recently, focused on mindfulness, cross-cultural therapies, and interventions. We've covered a variety of environments for which to review mental health, such as in schools and in the workplace. We've reviewed how different environments can put into place a variety of mental health practices. We've uncovered emerging mental health research in the areas of, for example, emotional contagions, how we are all connected, and how our emotions can transfer onto others. And we've also reviewed nutrition and mental health. Nutrition has played an important factor in how our moods and emotions are affected. We've looked at how micronutrients can also play a role in medication, and how the gut microbial access responds to different nutrients that we provide, and how that can affect our thought processes, our emotions, our mood. We've looked at the connections we have with each other through families. We've examined how emerging research in genomes and our ability to analyze large amounts of data can influence the field of psychology by examining our intergenerational preponderances towards different treatments, and how the ability to review how our ancestral heritage has been affected through different disorders. We can apply that information to practice through the use of genomes and by analyzing genomic data. We've explored different regions of the brain and how we're able to use imaging to examine different responses to therapies through experimental research, and also to examine how our senses respond to different therapies, and also applying that information that we gather from experimental research on both humans and animals, and how our advances in neuroscience affect the field of psychiatry. We've also used that information to examine how different medications respond to our body on a biophysical level, and exploring the biophysical-social domain as to where our bodies are affected by what goes on in our environments. And we've recently reviewed how philosophy has influenced the history of psychology. Psychology as a science is more recent science, and is influenced by some of the great philosophers such as Socrates, Plato, and more recently Freud and Marx led to the development of the field of psychology today, and exploring how their concepts that they've developed of the psyche have developed the psychotherapy approaches used in psychology, and recent psychiatrists such as Jung used that information to develop scientific applications of psychotherapy approaches that can be applied by the field today. And I'd like to take this moment to thank everyone again for continuing to advocate for mental health, continue to watch the videos, make sure to hit the like button, make sure to subscribe as we continue in our journey in mental health research. Thank you once again, and of course we have to thank the founder and creator, president of Mental Health Development Greenhouse, Dr. Ayodele Green, MD, who has made all this possible, made all this research possible, all this information shared. As the president of the Greenhouse for Mental Health Development,